everybody, welcome back to the Health and Hustle podcast with your girl, Charge Nurse Keisha, and my girl, Ass Nurse Kima.
Hey y'all.
Friend, I am so glad that we are back on the podcast today, talking about something very, very near and dear to, I think, a lot of our health journeys. Now, I don't want y'all to get it twisted. The Health and Hustle podcast comes with many topics. But something that me and Kima both can relate to is the GLP-1 community. We both are very, very are educators in the space. We both are on GLP-1 medications, and we both have lost a tremendous amount of weight on these medications. And so we have had several discussions about it, many, many days, many, many nights. It's so many topics that fall underneath the umbrella of GLP-1 medications. So many topics, but what I am seeing, I think what we both have been seeing in the community is a topic that most people feel, but they won't talk publicly about. It's something that I have struggled with a little bit. I mean, I don't know. I guess we will unpack it as we go in the conversation, but body dysmorphia disorder, often called BDD.
Yes, honey. That is a topic that we definitely can dig deep into. I
Yeah,
have my own little personal stories that we can definitely talk about for sure.
friend, I've been seeing a lot. I've been seeing a lot, especially since we are now over 2 years into our journeys. You know, we started with a lot of people that we see on social media that have changed physically, and I've seen people change mentally as well. But not to get off topic and to stay on topic of BDD, but to give a definition for those of you who are really not familiar as to what exactly is body dysmorphia disorder. Body dysmorphia disorder is a mental health condition where a person becomes obsessively focused on perceived flaws or defects in their appearance, often flaws that are minor, not visible to others. Y'all, that's key. It can lead to significant emotional distress, social withdrawal, and harmful behaviors like excessive mirror checking. I feel like I checked the mirror more when I was big than when I was small, because now that I'm small, I feel like I look good. I look good, boo. But people are suffering with checking your body and comparing it to others, or even avoiding public situations. So that is what body dysmorphia is. And so what's your thoughts on that? That's big. That's big.
First of all, it is big, but what that tells me is, honey, I've been suffering with BDD since I've been little because I stayed in a mirror. I stayed in a mirror. Look, you're on my desk right now. I'm always face
But
check.
did you like what you were looking at?
Now I did, but like you said, when I was bigger, I was more so checking to see where my clothes, how they were falling.
Yes. Is
You
my
know,
fat roll showing? Honey,
yes,
is this arm too big? Does
yes,
my back look big?
yes, all the
Okay.
things.
All
Yes.
right.
As a big
Now.
girl that was hippie, I was very self-conscious about wearing dresses that were too short because they would bounce up and down in the back.
Mm-hmm.
I wanted
Ooh.
to make sure they came down because I grew up in an era where nobody was going to tell you that you had stuff hanging out in the back. Okay.
Uh-huh. They want to
Nobody was going
see.
to tell you.
They want to see. Boys and the girls.
Yes, honey, all of them. I'm telling you. But you are right.
Right.
Definitely, I've been seeing it excessive mirror checking. And when I think about it, even when it comes to the sale of mirrors, now I'm seeing
Mhm.
a lot of floor length mirrors,
Yes, I
light,
have
all
heard
the
that.
colors, you know, and I see that like it's almost like the retailers are pushing that for us to
Mm-hmm.
sell.
Ooh, that's good. Yes.
So much that my 14-year-old is like, you know what, she needs this floor length mirror because she need to make sure she's good before she goes out the door. And I'm like,
Mhm.
you got plenty of mirrors down there, but hey, I guess this is the times that we live in, and maybe she's mocking what she's seeing me do too.
Yeah. Now, body dysmorphia disorder affects the GLP-1 community, men and women, in so many different ways. So, in my research, I have learned that because GLP-1 medications are used for weight loss and diabetic medication, and while they are dramatically improving health and confidence, they also intensify body image issues for people. And one of the ways that I learned in my studies, and one thing that I wrote down, Kima, for us to discuss today, is the unrealistic expectations that we all, because I'm going to couple myself into that. I'm not going to exclude myself.
Right.
Unrealistic expectations that we all put on ourselves. For instance, Individuals may become hyper focused on achieving perfect bodies beyond medically healthy goals. And then rapid weight loss can trigger distorted body image, especially if underlying body dysmorphic disorder issues weren't addressed before starting your treatment. Now, I can remember as a nurse, when patients would have to go through weight loss surgery, they would have to have psychological evaluations and therapy, right?
That's right. That's
Yeah.
right.
So I personally feel like maybe this is something like people need to sit down with themselves and have an honest conversation with themselves to see if this is something that they may want to incorporate into their weight loss journeys.
No, absolutely correct. And not only did they have to have the mental health check off, I remember having to meet with a nutritionist.
Mm.
Review, do you know what you should have not have based on your medical history? And they had to sign off before you could go and have your procedure done.
Mm-hmm. They're going to TikTok now. Ah, they're going to TikTok. They don't want to speak with the professionals no more, baby. They're going straight to TikTok to the influencers.
That's it. That's
No
it.
shade. No shade.
No shade,
But
no
I mean,
tea.
it's true. I see it. I see it.
You're right. And so when I did my digging, what I noticed was the before and after pictures, that culture of showing the before and after transformations on social media,
Mm-hmm.
as a way to trigger.
Entice. Uh-huh.
Yes.
Mm-hmm.
Because not only are you going to post your pictures, but you are constantly seeing other people's pictures.
Mm-hmm.
You're looking at where they started versus where you started, how much they lost versus what you lost, what their body shape looks like versus your body shape. And when I look at the stats, I notice people put their heights, their weights in. And of course, I also see or hear other people talking about, well, I'm 5'5". Why didn't I lose 100 pounds?
Yeah. Yeah.
Why don't I look like this person that started at 250 and is 5'5", just like me?
Mm-hmm.
Similar. What's the issue? But I think a lot of that comes from looking at those before and after pictures.
Uh-huh. It's starting to get competitive, honey. It's starting to get dangerous out here in these GLP-1 streets. And when it comes to individuals becoming hyper-focused on achieving the perfect bodies, that is starting to trend on social media as well. So it's like the medication taken and the surgeries as well. And we gonna dig deep into that before we finish this conversation.
Yeah.
So when you're on GLP-1 medications, I wish, as a nurse, people would see the whole picture and, consider some of these things that may happen, along your journey, like developing a body dysmorphic disorder or comparing yourself to others or setting unrealistic expectations as far as what your body would look like from start to finish. Whenever I am educated in the community, if I can catch a newbie, I always tell them, now imagine how much weight you want to lose. And then also imagine if that's going to make you happy, because you've seen yourself as a fluffy, beautiful person all this time that you have been battling, obesity, because obesity, let's be clear, is a disease. Right. Are you going to be able to recognize the person in the mirror at the end of your journey, at your goal? And as you are getting to that goal, are you mentally preparing yourself for that change? Because it's going to be dramatic.
Absolutely. And just to add to that, so you are a newbie or not, starting on this journey, and you have in your mind goal weight or ideal body shape. Do you think when people ask you, newbies, Keisha, Charles Nurse Keisha, what did you eat when you started your journey? Do you think that in the minds of the newbie, they're trying to determine if they eat how you eat, that they would end up looking like you look?
Mm-hmm. Are you asking me?
I'm asking you. Mm-hmm.
I would say that's exactly what they doing, because people don't understand, which is why we educate in the community, that we push genetics plays a part, comorbidities play a part, the type of medications you play a part that you're taking, family history play a part. People not even thinking those things. They just want to know what you do, because if I do what you do, it's gonna work for me. No, because baby, we don't metabolize the same way. You're not suffering with the same thing that I'm suffering with. You understand? I may be insulin resistant, you may not. You understand what I'm saying? So that's why I feel like it's so important that we continue to educate in the community, because we collectively want to see people get the whole picture and not just the glory or the theatrical part of it, I want to call it the stage play part of it, honey. There's other things that come before, action. It's things that you got to prepare yourself for before you get on that stage and you start, going down this GLP-1 journey. And so that's why I think it's so important that we continue to educate, because people still don't know, friend. We've been talking about this for 2.5 years
Yeah.
plus.
Yeah.
And, unfortunately, they still don't know. And then people that are coming behind all of the vets, we got to catch them while they're young. We got to catch them while they're new in their journey, so that we can get their minds straight and get them with the right minds, that they can have the best outcomes.
No, absolutely. I totally agree with that. But I just wanted to get your point of view regarding that, because I hear a lot of times, and I'll use the supplements, electrolytes as an example. When I first started, I would hear people say, you need to drink electrolytes every single,
Mm-hmm.
electrolytes every day. And I'm like, okay, but if you're not working out, what are you replacing?
Right.
You know, because then you're gonna be mad when that scale goes up because you're retaining, and or you end up in the hospital because your electrolytes are thrown off,
Right.
balanced or whatnot. But I just wanted to get your thoughts on that. Something else that I noticed, and I don't know if we want to get into it now or kind of push that back with the surgeries, is having the loose skin after
Mm-hmm.
starting the GLP-1 medication and getting down to goal weight, and or hitting a weight plateau, how that affects the community,
Mm-hmm.
because I, for one, can say 145-pound Kima at 18, 19 years old does not look like the 140-pound Kima, adult Kima. I have extra skin.
Mm-hmm.
I went from 148, 180, 200, over 300 pounds. So I have
Mm-hmm.
all this extra skin. But I remember it being in the community in the early stages, and people were saying, oh, I'm not having surgery. I'm not going to have loose skin. And now here we are.
That's all we talk about. That's all we talk about.
That means
Friend, I was at work. I was at work last night showing how big my ass used to be. I was like,
that,
y'all, look at this picture. Honey, it was round, honey. It was round. I want to get back to that. So you don't think when you're on your GLP-1 journey that your body is gonna look distorted.
yeah.
Like, let me tell you something, honey. I've always loved to be hippie and to have a round butt. Now that's one thing, honey. I was like, just don't let me lose my butt. I want to lose everywhere, but don't let me lose my butt, honey. But you don't have no choice where your body gonna lose at. It's gonna lose
Right.
where the hell it wanna lose at.
That's
And
right.
so, when you were talking about, the loose skin and the surgeries, Kim, I'm not gonna lie. I want to have a surgery, and it's not because of body dysmorphic disorder. It's because I just want to look how I feel. Like, I'm not sad about how my body looks, but here again, it isn't something that I even considered going into my journey. Like, I did not consider when I was losing weight that I was gonna start having dimples in my butt.
Mm-hmm.
It just happened. Fat cells, where the fat cells gonna go away at, we don't know. We don't know how much loose skin. Now we can speculate that we're gonna have loose skin, but we don't know how dramatic it's gonna be.
That is
You
true.
know.
That is true. When I started the journey, I had the dimples on my thighs, the back of my thighs. But when I realized a non-scale victory for me was the fact when I looked at the back of my thighs and those dimples were gone. So I was like, okay, we're doing something, okay? But I too,
Almost like them rolls on my back.
hello, gone, back flat, rolls be gone, okay? But you know how I feel about surgery. I've always been on board for surgery. I feel like, you know what, if you want it, get it. That's how I feel. But I'll be real honest with you. I want the surgery to clean up what I've lost, tighten it up.
Mm-hmm.
But you know what? It's really because of the type of clothes I want to wear. Now, I'm not saying
Ooh,
it all
you
appropriate,
better speak on it.
but honey, I don't want to be dressed. Okay.
You better speak on it.
When I was in college, they called me sweet naked for a reason. Okay.
Okay.
Let's take it back. I don't want to wear a whole lot of clothes. So that's what's really important to me, that I can walk around and you can see the string bikini. Okay. And it's not twisted up in the fat roll in the back.
Uh-huh.
You know,
Yeah. Honey, I get it.
Jeez.
I get it. Yeah,
Let's
honey.
be honest.
I want to live the thong life.
Yes.
I've never experienced that in my life, and I never judged someone who had,
Right.
but and listen, you see how we having this conversation about how we want these things to happen, and it's just naturally sitting here, and this is the thought that we have, just being honest about the thoughts that we have. There are a lot of people having these same thoughts and conversations, but they are moving recklessly,
Mhm.
physically and mentally to get it. So that's what this conversation is more about. I want to highlight how it can get dangerous. You understand what I'm saying? So this is something that a person needs to be able to identify with, if this is something that you're doing because you just want to enhance, like you said, the beauty that you already have going on, or are we doing, or are we distributing reckless behavior and moving recklessly and having surgery after surgery, taking different things that just can harm us down the line? Are we really, how desperate are we getting out here in these GLP-1 streets? So that leads me to a topic that I came across as we were doing research, and it's called the never enough mindset. Okay, so what it basically means is, even after significant weight loss, some still see themselves as overweight or flawed, which can lead to compulsive dieting, use of harmful medications,
Mhm.
and distributing risky behaviors, and doing multiple surgeries, which is what I feel like this is something that we definitely are seeing in the GLP-1 community right now. There's a whole different type of community called the gray community. My algorithm on TikTok was over there, honey, and it's dark. As a nurse, and here's the thing, because I definitely don't want to come off judgmental,
Mhm.
and I don't want anybody to feel no ways tied about what I'm saying. I'm just a little nurse, honey, with a little education, but a whole lot of common sense. And just from my medical background, being a nurse for 23 years, the things that I have seen in cardiology, I've worked in med surgery. I've done cardiac, IMU, IMU. I've done, I work right now under the umbrella of emergency room medicine and outpatient medicine. I have seen so many things. I've seen so many people do risky things to themselves for whatever reason. But what I'm noticing in the GLP-1 community, like, there's a desperation for weight loss. And I'm not even gonna say it's for just weight loss. I think people realistically just want to be healthy.
Right.
They want to have longevity. They want to have better quality of life. And now they know that it's obtainable. And because the price of these medicines are so expensive, it
Mhm.
is making them detour on the dangerous, on the dark side. And I just hate to see it. I hate to see it happen, but it's definitely happening. It's definitely happening. And I just want to be the vessel that gives all the communication. I want the Health and Hustle podcast to definitely be the vessel to give the best education possible, so people can have everything and then go out there and make the decision that you feel that is best. But just know, right or wrong, if it goes good, great. If it goes bad, we still gonna be here to help y'all.
Right, right. And speaking about going gray, because yeah, I've definitely seen my FYP as well. And I've gone down the rabbit hole just trying to get an understanding, not being judgmental, but just trying to get an understanding.
Mm-hmm.
So I've seen like a couple of different scenarios. I've seen where members in the community can't afford medication,
Mm-hmm.
a brand or a compound. So it becomes affordability.
Yeah.
And I've seen in some situations where it's vanity. It's well,
Mm-hmm.
I'm just trying to go out of town in 6 months and I need to get this Retta because it's going to do better than the Manjaro. And so I'm going great. So I can get it real quick and do what I got to do. So I've seen that as well. But if what's so crazy, even in all of that, is no one seems to be concerned about possible side effects. I've not seen one person make a post or a video about side effects,
Mm-hmm.
about or what will happen in 2 years down the line. You know what I mean? That to me was a bit concerning. It's more so affordability that I've seen as well as the vanity piece to it.
Yeah.
I mean, people gonna do what they want to do, and I get it.
Yeah.
I'm not here, like I said, not here to judge, but if you ask my opinion, I definitely will give you that. I just want people to be safe and
Right.
make decisions, be cool with it, and make sure your doctor knows that, hey, this is the route that you're taking,
Right.
you know? Um, but speaking on the multiple procedures, like when is too many procedures enough? You understand what I'm saying?
I do. and it's hard to determine that. It's hard to determine that outside looking in for a person, because you just don't know what people be struggling with mentally and why they're doing what they're doing. Like somebody may look at me and say, well, Keisha, you lost 95 pounds, but you don't need to have, because this is what I want to do. I want a skinny BBL. I want to have liposuction, and I want my hip dips to be filled out. And people could look at me and they say, girl, your body looks good. Your body looks good, but honey, you ain't seen me naked. Okay. And you don't see these hip dips like how I see these hip dips. So, I just think I feel like too much. Let me just answer the question. I feel like too much is when it starts to affect you physically and mentally. Like when you start having uh post-op infections, you down, you start having blood clotting, you've had blood clotting, things like that, and then you still want to go back. You've been in harmful situations post-operatively, you have reactions to anesthesia, and you still want to go back. That's when I feel like it's getting dangerous, or that is your only focus. All you're talking about is the body, the body, the body, and you're not addressing the mind. I feel like that's when it gets dangerous, like how the body dysmorphic, the definition says you're always checking the mirror. Like you're so obsessed with the mirror, you can't even enjoy your time out because your mirror is all the time. Your phone is out all the time. You always taking pictures. Every time you walk by a window, you looking at your reflection and you get compulsive. That's what I think. That the body dysmorphic has set in, which can push people to want to. You might walk by and see a little bulge in your back. Oh, now you got to get some more lipo. Or you may cross your leg and see a little bit of a pitch of fat right here. You want to get lipo in your leg. You want to get the nip tuck. I feel like maybe that's when it becomes too much. But hey, that's my opinion.
Yeah, you right. So now let me ask this question because I want to know what the skinny BBL is. So what's the difference between a skinny BBL and a regular BBL?
So a skinny BBL it goes up according to how many cc's you want put in the buttocks area. Okay. And listen, I haven't done much research on it yet because I haven't made a clear indication of if I'm actually going to do this, but it goes to the amount of cc's you want placed in that particular area. And I want very minimum because I'm a very shapely girl. I'm very shapely. I just want to be able to wear a thong and I want my skin to be smooth. Because here's the thing, friend, I'm getting older. I'm 48 years old. And as far as I'm concerned, I didn't have my 30s because I was dealing with a cancer diagnosis in my 30s. So I feel like, I'm behind, when it comes to an experience in my life. So I'm 48, but I honestly feel like I'm 38. I'm still in my 30s and I want to look like I'm in my 30s. You understand what I'm saying? And, and although I feel like after I lost all of this weight that I don't look bad, I feel like I look damn good, but I want to look better.
Honey,
shit, that's just what I want to do. I want to look better.
No, I feel you on that because I say the same thing. So, and I have to say, I'm very guilty of even when I look at you and I'm like, no, Keisha, I don't see what you see. Like I can honestly say that I've said that when it relates to you, but even when I look at myself, people tell me the same thing, and it's like I say, you have not seen me naked. You don't know what it looks like underneath these clothes, okay? But to speak to the question about when is it, too much, what comes to my mind is when you have to lie about your medical history. It's time.
Ooh,
it's time.
That's big.
If you got to lie to get a clearance for a procedure, you've done enough.
Yeah. That's a red flag.
Yeah, you've done
enough. It should be a red flag.
Right.
For yourself.
For sure. And wow. Because I'm definitely into, and I remember some years ago, I was thinking about going to the DR. It was already set. $6,300. I'm going to the DR. I'm gonna stay 2 weeks. I'm going by myself. I'm gonna have a mommy makeover, and that's just what it's gonna be. But I ended up having a stroke, so I didn't go. But now, looking back, I'm like, do I really need to have a mommy makeover? Or am I okay with certain areas? So I can say what's more important to me is my belly. So I want that full tummy tuck off rip because my weight is wasting. So let me get that tummy tuck done. And then probably in about 6 months, maybe we'll do a little lift. Because that's okay. That's not that big of a deal. A couple of days off of work and I'm going back, have it on a Thursday. I'm back to work on a Monday. That's how I'm thinking about it. And then I'll maybe work on my thighs because I definitely looked at having a thigh lift as well,
Mhm.
because I have a lot of extra skin there. But I too want to be thicker than a Snicker.
Yes, honey.
That's what I want. I want a small
Mhm.
waist. I want my thighs to be full, and I want my
Mhm.
butt to be bankhead bouncing. You understand what I'm
Mhm.
saying?
My baby call it slim thick.
Yeah,
Okay.
that's what I want. That's what I want. Yeah.
I love it.
Now, I did look up some resources, friends. So we definitely have some resources to share because one thing you know about two nurses on the panel and providing education now, we're going to talk about all the things.
Mhm.
And I also provide you with some resources as well. What type of nurses would we be, right?
Come on, friend.
So just a few. Number one, the National Eating Disorder Organization. So it's going to be nationaleatingdisorders.org. Okay. Body Dysmorphia Foundation. So that's going to be bddfoundation.org. That's going to be your second one. And then, of course, as a third resource that I feel like a lot of people are very much so comfortable with is using support groups like Reddit for the GLP-1 community, Facebook, and weight loss forums, as well as mental health forums also. Okay.
That's good. That's good. Thank you for that, Kima.
Yeah.
And we definitely will put all of that information in the description of this video. But before we head out, it was one last thing I wanted to touch on, friend, that I feel like is a big part of body dysmorphic disorder is when patients who are on, or I don't want to just relate it to GLP-1 medications because it's not just GLP-1 people that deal with body dysmorphic disorder, but
Right.
when I wanted to talk about mental health neglect for these patients. The focus on physical transportation may overshadow the need for physical support, especially for those who are already struggling with self-worth and disordered eating. So if you are a person who is already struggling with those type of things, before you embark on any type of weight loss journey, you definitely need to get that situation um, controlled, or get with the resources that we provided for you, talk with someone so that they can evaluate you and actually follow you through your weight loss journey to make sure that you don't fall into the things that can trigger you or provoke BDD in you, or escalate those type of
Right.
situations. So that's very, very, very important. So know what it is and be able to identify it. And if you identify that in yourself, it's okay to get help.
Mm-hmm.
It is okay to get help, friend.
Mm-hmm. Absolutely. And you know what? Speaking of that, Keisha, I wanted to just mention, we talk about BDD. It does not just affect someone that's in a larger body going down to a smaller body.
Mm.
No, when I hit my goal weight, I was satisfied, but I kept losing. I kept losing.
Mm-hmm.
And when I would look in the mirror, I would see myself, but it did not, what I saw
Mm.
with my eyes did not match what my brain processed, nor did it match what my eyes saw on the scale.
Mm.
And so to me, when people said, you're kind of tiny, I'm like, I don't see what y'all see. I don't
Mm-hmm.
see what y'all see, and I still have those moments now. Let me keep it a buck with everybody that's listening and watching. I still have those moments where I can look in that mirror. I mean, I check that mirror every time I go in the bathroom.
Mm-hmm.
I stand in front and then turn to the side to see if it changes back there. You know what I'm
Mm-hmm.
saying?
Mm-hmm.
And I say to myself, I don't see what they see. Like, I get what the scale says, but I don't see that like with my eyes. And again, I don't process it that way with my brain. And I have a counselor that I speak to about that. But when I have those moments and I'm like, it's just not adding up to me, honestly, I have to pick up the phone and have a conversation with a friend because I'm thinking in that moment, do I need to change my maintenance dose? You see where I go with that?
Mm-hmm. Mm-hmm.
Um, but I shouldn't. But I do,
Yeah.
my numbers say you're
My
good.
God.
The scale saying, Kima, you good. Visceral fat, low as the Dickens, Kima. Metabolic age, you right on top of it. But the way I process what I see on that scale and those numbers is really not like how I feel. The
Mm-hmm.
point that it makes me go back to the drawing board to say, do I need to adjust my dose?
Mm-hmm.
Do I need to put compound down and go to brand? But
Mm-hmm.
I shouldn't have those thoughts at all because nothing's wrong,
Right.
you know. So I don't know if there's other people out there in our community or just people out
Mm-hmm.
in general in the world that have those thoughts, but just know as Nurse Kima
Yeah.
definitely does, you know.
And in my mind, I'm thinking, is that normal? Is it normal for us to feel that way? You know, is this something that you need to look into to discuss with your doctor so that you can get some type of explanation as to why you're feeling like that? And will that ever go away?
Right.
How long is it? How long do you have to be in a side? You come from 300 to 160. How long do you have to be in that 160 body before you realize, Kima, I did it? And I'm saying that because I'm really speaking to myself as well, because I'm thinking while you're talking, I want to ask you, if you had to be 100% satisfied with your body after weight loss, what's your number? What's your percent?
As in how I look right now,
Mm-hmm.
70. Right now.
70?
Right now. Because I can think of stuff I want to do.
Mm-hmm.
I can say, you ask me, Kima, do you want to change anything with your face? No, ma'am. I'm good.
Uh-huh. Uh-huh.
Oh, yeah. You understand? But when you get down to, okay, Kima, what about your arms? Because I can
Oh
see,
yeah.
let's make a change right here. Okay, Kima, what about, I can make a change right here. What about your belly? Oh, I can make a change right there.
Mm-hmm.
I literally can go from top to bottom and point out areas like, okay, let's make adjustment here.
Mm-hmm.
So for sure, the only thing that being at my current weight that puts me at 100% satisfaction is my confidence, my ability to share my journey in this space card. That's the truth.
Ooh, that never fails.
Mm-mm, mm-mm.
And listen, I want to be very clear. If people think that they want to fix their arms, their breasts, their bellies, their legs, baby, do it. If it's going to make you feel, if it's going to mentally gather you and make you feel, have the best confidence, where that you have the best energy, that you are good vibrational, baby, go get it.
Yes,
Go get it.
yes.
Go get it. If it's going to offer healing, go
Mhm.
get it. I'm for it. Honey, I'm for it.
Yes,
I'm 100% for it.
I'm
But
gonna.
I also want people to understand or be able to identify when, you know, enough is enough. And, so I cannot determine that for nobody.
Right.
I don't even know how doctors be able to determine that, because I feel like if you go get all of these surgeries, honey, you living your best life, you have the best vibration, you have the best mood, you pouring back into yourself, into the community, the people that you love, and you're doing it in the most healthy way, like you moving to make sure you're going to come out on the better side of this instead of just doing reckless behavior, honey. I'm for it all day long.
Yes. Yeah.
Baby, who's your surgeon?
As soon as you said it, it made me think back when I was working in the nursing home. And I've had many patients, just on this side of town where I live, that come in, baby, the face is still tight
Mm.
and the breasts are still sitting up. I'm like, they 85, 95.
You understand me, honey? Because when it's my time, I'm gonna get my face lift. This face is always gonna be taut. Now, honey, I might look surprised.
Surprise, surprise.
But what you ain't gonna say they got no wrinkles over here now. Honey, especially got that glutathione on now, baby. I'm ahead of the game.
Ionic.
I'm ahead of the game on y'all. Okay, this is a 48-year-old face, honey. All right, and I just want my body to compliment my face, and I feel like it does. So if I had to give you a number as to how I felt, with my body, Kima, I would say I'm at 88%.
Okay.
I'm at 88%. I just need a little bit, because even though I have these big old, you can't even see it, honey. I got these big old arms, and I will always have big arms. I'm very confident now with them. I ain't gonna say I'm confident, but I have come to terms with, because I had mastectomies, I'm gonna always have lymphedema because I don't have lymph nodes, and your lymph nodes is what drains your fluid. So fluid is gonna pool in my arms, which is okay. I'm okay with that, I wish that I did not have to live with it like that, but that's the way God made me. I'm a breast cancer survivor. So that's if that's the least that I have to deal with, honey, these arms gonna be out, honey, all summer long. Okay. But the only thing that my 12% issue is that I have a short torso. And when I gain weight in my midsection. And I just want, and I'm a short girl and I want to have an hourglass body like the talls. That's all. I'm a small that want an hourglass shape like the talls. That's it, honey. And I'm gonna pay to get it. Boom. Boom. Drop y'all surgeons in the chat. Okay.
Okay.
I mean that.
For real, no. I'm with you on that. I really want my body to match my energy and where I'm at.
Yeah.
Like, yeah, I'm in my 40s, but like my daughter always says, she was like, Mom, you do not act like your age. I'm like, well, how am I supposed to act? Like, I'm me. I can only be me, honey.
Honey, I feel like I'm in my early 30s. I ain't in my early 20s now because at 8:30, 9 o'clock, I'm going to bed. But before I get there, honey, I'm gonna have me a grand old time, honey. I'm gonna have me a good old time, baby. Yes, ma'am.
All right, friends. It's been nice catching up and chatting with Charles Nurse Keisha as we talk about BDD and how it affects our wonderful community, GLP-1 community. So what we want to do is make sure that you, of course, like, share, and subscribe to our channel. Make sure you're following us on all platforms. And of
Mhm.
course, make sure you drop a comment because we love feedback.
Yes, give us some feedback, y'all. What do y'all want to talk about next?
Absolutely. We're two nurses that's just chatting. We're friends. So, you know what? It's very chill environment. So make sure you drop those notes in the chat. So thank you all for watching. Okay. And have a good day.
Bye, guys.
Bye.